Hello, this is Dr. Paul Goldberg at the Goldberg Tenor Clinic in Tyrone, Georgia. Sometimes I get really irritated about a lot of things that are going on medically, healthcare-wise, and I've been in the healthcare business profession for about 50 years now. And one of the most egregious problems that we have is when medical professionals take away our power through the use of specific hormone replacement pharmaceuticals, specifically thyroid hormone replacement therapy. We have about 70% of the women that we see in practice are on some type of thyroid hormone replacement therapy. Now, not too often are they coming to us because of that. It just happens to be incidental. They're coming to us because they have autoimmune problems. They're coming to us because they have digestive problems. They're coming to us because they have terrible fatigue. They're coming to us because they have ankylosing spondylitis, psoriatic arthritis, rheumatoid arthritis, ulcerative colitis, all kinds of other degenerative problems, chronic disease problems. But in taking the history, we find out that they're also on hormone replacement therapy. And a lot of women just, I've been on it for a year, 5 years, 10 years, many, many years, and they're not feeling well. And what happened, the normal scenario, the typical scenario is the lady goes into her medical physician. She says, "I'm tired, doctor," or "I feel cold all the time, doctor," or "My libido is low," or "My memory is getting bad," or "I'm gaining weight. I don't know why, I can't seem to lose weight." So those are some of the typical things that might set off the medical doctor's mind. Let's check your thyroid gland. Okay, fair enough. So he orders a thyroid panel on the lady through a lab, and it comes back and it shows that their level of thyroxine is low. He says, "You're hypothyroid, low thyroid, and we're going to give you thyroid replacement. So here's a prescription for Synthroid." And now for the rest of her life, she will need to monitor that thyroid gland and take that drug, that hormone replacement therapy, every day of her life. But something happens that the medical doctor, the physician, didn't tell her. He didn't tell her that by taking that thyroid replacement therapy, that her own thyroid gland was gradually going to degenerate out. And that if you're not using the gland, it's going to stop working. Well, if the thyroid gland is receiving the drug that you're taking, and your thyroid level, thyroxine level is normal now, or above normal, it stops working. It says, well, I can't put more hormone in there because she's already got enough. So as it starts not working, it loses its ability to function until after a number of months, years, decades, the gland is gone. It literally atrophies out. And this is something I have rarely found that medical physicians ever tell their patients, because if they did, a lot of women might choose not to go on it. But there's something else that there is a problem here too. Not only that they don't tell the woman she's going to be on it for the rest of her life, they don't tell her that the glands are going to eventually atrophy out. Rarely do they tell her that. But if they put her on thyroid replacement therapy, chances are they never said, "Your thyroid is low. Let's find out why. Let's see if we can get it functioning again." At our clinic, that's what we would do. We run thyroid panels on people too. And if we find somebody comes in, could be a man too, but it's usually a woman. If they come in and their thyroxine level is low, we're going to say, okay, let's see what's occurring with you that's causing that gland to function in a less than optimal state, at a hypo state. So we call it hypothyroidism. Now, what kind of things can lead to that? There's a wide variety of reasons why that thyroid might not work well. We've had women who come in and their thyroid's not functioning well because they're not getting enough sleep. Not enough sleep could cause the thyroid to function well? Absolutely. Women come in and sometimes the thyroid's not functioning well because they've been under an inordinate amount of stress for an extended period of time. And the thyroid gland, along with the rest of the glands of the body, is just getting worn down. It may be because they're missing an essential nutrient in the body. And the thyroid is very nutrient dependent, like the other glands are too. But the thyroid particularly has needs for a number of different nutrients, including things like iodine. Okay? We also find that in some people, the thyroid gland is not functioning well because being interfered with by other drugs the person is taking and or by toxins that they've built up in their body over months, years, and decades. This calls for a toxicological study. So we run a tox panel on the person for things like heavy metals and organochemicals, because these too can interfere with the function of the thyroid gland. So we need to identify the causes, which is if the person's just been thrown on the thyroid medication was not done. We have to make sure that the medical profession needs to tell them that once they go on these drugs, the thyroid gland will stop working and eventually won't work at all. And the third thing is, and this is important, is that no matter how carefully you monitor that thyroid prescription level, whatever thyroid replacement drug might be, levothyroxine, aka Synthroid, or Nature Thyroid, or these other hormone replacements, it will never work as well as your own thyroid would on its own. Why? Because on a daily and nightly basis, the thyroid gland monitors the level of thyroxine in your blood, not just hour by hour, day by day. It monitors it second by second. So at all times, it is putting out just enough thyroxine so you don't become hyperthyroid, you don't become hypothyroid. You have just the amount that's just right for you. Whether you're working, whether you're sleeping, whether you're eating, whatever it is you're doing, the thyroid now is going to put out enough in coordination with the other glands of the body, because it's affected by other glands too. It's going to put out just enough thyroxine for the optimal amount for you at that moment. I'll mention one other thing to you also. We have a number of people that come into us that are on thyroid replacement. If they've been on it for less than 2 years, we normally are able to get the thyroid working well again so that they can get off that thyroid medication and bring the thyroid back to life. And that leads itself to a lot better clinical results for that person, feeling a lot better, not having to worry anymore about their own thyroid becoming defunct. Now, the longer they've been on it, the less chance there is for us to be able to get them off of it. Do we tell the woman not to take it anymore? No. We just do an evaluation of them, find out why it is that the thyroid may not be functioning well, get them on a well-planned health program, creating the right conditions for health, and then monitor them and watch for that thyroid gland to start coming back. And we monitor it in several ways. One, how the woman feels. Number two, what her thyroid blood levels are like. And number three, what her temperatures are like. And we screen all women and men, what their body temperature are like. We give them a little chart to fill out when they first come in, and they record their body temperatures when they first wake up in the morning just by taking a thermometer, putting it in their armpit, and leaving it there until it beeps. And we can see on the average if they're producing normal amounts of heat in the body, because that's one parameter of normal thyroid function. Here's something else interesting. Now, I pointed my finger at the medical profession because they're the ones that prescribe. These would be osteopathic or allopathic physicians. Oftentimes, it could be a general practitioner, it could be an internist, oftentimes it's an endocrinologist. They're the ones that prescribe these medications. Recently, and I mean March of 2023, Yale University School of Medicine says that 90% of the women who are taking Synthroid may have been unnecessarily prescribed that drug and don't need to be taking it. One thing we know for sure, however, the longer they're on it, the more the chances are they will eventually need to take it because their own thyroid will become defunct. Another thing that needs to be considered is that the blood levels for thyroxine, they vary from season to season. Chances are your medical doctor doesn't know that. And if he takes it, for example, in the wintertime, the levels would be normal during the wintertime are different than they would be in the springtime or the summertime. And so a lot of women may be unnecessarily prescribed thyroid medication because of the fact that there's a seasonal variation, and during the time of the year that the blood is drawn may be a time when the amount in the blood varies. And it may be perfectly normal for that person for that season. Bottom line is of all of this is that we're best off not trying to tell the body what to do. Your endocrine system, your glands, they know how to control the right amount of hormone for you at any moment. And we certainly don't want to interfere with that function by giving them exogenous hormones, that means hormones from the outside, and interfering with their normal workings. However, if somebody's glands are functioning low because the conditions they're providing for that gland are not correct, now let's do the logical thing. Let's identify where the problem's at. Let's address that problem thoroughly. And then we watch the person return to a highly vital state. Not difficult to analyze as long as we take the time and we make the effort and we're thorough in our analysis. At the Goldberg Tenor Clinic, our motto is causes identified, causes addressed, and health restored. And this is what should be done for all people, no matter what their health problem is.